we begin with a growing epidemic among American children. And tonight, a new recommendation on how hundreds of thousands of those kids should be treated. We're talking about type 2 diabetes, a problem that is confounding more doctors, families, and healthcare professionals every day. Now, the release of a new report offers new insights. Here's Tony Guida.
Type 2 diabetes was never seen in young people as recently as 15 years ago. Now it's occurring with alarming frequency. Doctors know that a major risk factor is obesity. Beyond that, they were mostly in the dark about this disease.
Very little is known about the right way to both prevent it and to treat it.
A new study out today in the New England Journal of Medicine finds that the standard treatment for type 2 diabetes in children is ineffective because the commonly prescribed drug, metformin, effective in adults, has a high failure rate in children. But that a combination of two diabetes drugs is far more effective in treating young people.
Two drugs right off the bat, that's an important finding.
So there's no added sugars.
Important because type 2 diabetes appears to be more aggressive in young people between the ages of 10 and 17, putting them at great risk for life-threatening illnesses typically associated with seniors.
We want them to grow up and have healthy lives and not be having heart attacks and strokes at terribly young ages.
How's the gym been working out?
Good.
That wasn't a good.
When it comes to preventing type 2 diabetes, more exercise and a healthier diet are key. But doctors know young people's habits are tough to change.
The first surprise that we saw was, number one, how incredibly difficult it was to affect lifestyle change in these children.
Extremely difficult as well to get children to take any medicine, let alone two drugs. Spotlighting the oldest truth in medicine, better not to get the disease than to have to treat it. Tony Guida, CBS News, New York.
For more now, we're joined by Dr. Robin Goland of Columbia University Medical Center. You just saw her in Tony's piece. She joins us here on set. Doctor, the new recommendations, a two-drug regimen in teenagers, that's not easy.
Having a chronic illness is hard for everyone. For someone who's as young as a young child or an adolescent, very challenging. Taking medicines chronically, especially two drugs, would be very difficult for a teenager.
Do you see the problem of type 2 diabetes in teenagers getting better in the next 10 or 20 years?
Ideally, you'd like to prevent children and adolescents from getting type 2 diabetes. It's possible as these kids grow up, their insulin resistance will lessen and it'll get easier. That's something to hope for.
All right, Dr. Robin Goland, thank you.
Thank you.